So hey everyone, good day to all. So now we are discussing the second part of our guest paper. Okay. So guys, this is our Telegram group and this is our Instagram. Okay, where I am sharing some important MCQs and the discussions are going on in our Telegram groups. Okay. So for the PDF guys, the link in the description. Okay. So try to get the PDF from there and look at, and please follow me on my Instagram. Okay, so let's go. Okay, now yeah, can anyone try this one? What is this one? Calculate GCS of a patient exhibiting eye opening. Tell me the answer. Calculate GCS of a patient exhibiting eye opening on painful stimulus, conscious but confused and unable to tell time, and exhibit flexion on painful noxious stimulus to the arm. Don't say simply 10, 9, okay na? Don't say like this one. You have to be very careful. How 10? Okay, see GCS see GCS, so we have to remember like see EVM. Okay, EVM see EVM, eye opening, V for verbal response, M for motor response. Okay, so EVM, see EVM 456, EVM 456, EVM 456, say, okay, all of you. Okay, EVM 456, EVM 456. Okay, the highest score in the eye response is going to be 4 and the verbal response is going to be 5 and motor response is going to be your 6. Okay, so tell me, here, so if the patient is opening his eyes spontaneously, got it? If a patient comes to you and says, doctor, I have this problem, meaning he is opening the eyes spontaneously, don't worry. So it's going to be your 4. If a patient opening his eyes by sound, it's going 4, pressure 2, and if not opening is 1. This is very simple. Okay, everyone will know this one. Next is the verbal response. Okay, verbal response. This next one, verbal response. Okay, see here, yeah, for the verbal response, remember the one mnemonic is that one. See, one confused words sounds however. One confused word sounds however. One means what? O for your oriented. O for oriented. Okay. See, confused words sounds however. One confused word sounds however. Got this mnemonic? Okay, now. So if there is no response, if the patient is oriented, you have to give the score 5. Confused 4. Words, inappropriate words 3. Sound, he is giving unappropriate sounds. Okay, now if you are going to ask you what happened to, he will tell yeah, like this sound. Okay, na, meaning he is not unconscious, so you have to give 2, and he is not responding. This is 1. Okay, next one in the motor. If he obeys 6, everyone will know, will remember the 6. The obeys 6, localize 5. For the normal flexion, it is going to be 4. Okay, na, normal flexion. For the abnormal flexion is going to 3, and abnormal extension 3, 2, and the not responding is going to be your 1. Got it? So not responding is going to be your 1. Okay, so tell me right now, what is the GCS here? So calculate GCS, eye opening. Yeah, eye opening on painful. How much? Eye opening painful stimulus. How much? 2. 2. Okay. Next one. Conscious but confused. How much? 4. Next, unable to exhibit flexion. This is your normal flexion. How much this one? 4. Total 10. Got it? Total 10. Okay? Got it? So next one. Tell me the second one, Ra. If Jesus is less than 7, what we will do?
Intubate.
Yeah, you can intubate. Okay, na? Meaning he is unconscious. And if less than 3 means what happened?
Brain dead.
Coma. Got it? That's it. Very simple. Yeah. Can you tell me what is this one milestone? Why this child is crying? If she is her mother, then why he is crying? Tell me, why this guy is crying? Hey, bolo. Because she is not child's mother. Got it? That's why child is crying. Meaning it is a what type of? It is a stranger. Bolo.
Stranger anxiety.
Yeah, stranger anxiety. At what age it will develop? At what age it will develop? At 7 years, 7 months. Okay, na? This is the question. Okay, na? Can you tell me at what age a child can draw a triangle?
5 years.
5 years. Great. Square?
4.5.
4.5.
4.
4.5. Next one. Straight line? 2 years. Okay. Circle?
3 years.
3 years. Great. Okay, next one we are moving. So there is some important milestone you have to master. So most probably at the last exam, mostly they are asking this one: transfer objects, 7 months. See, sit without support. See, sit with support. Sit 6. Sit 6. See, sit 6. Okay, 6 months. Okay, got it. This is exam question. And this one, social smile, 2 months. 2 months social smile. Okay, na? Next one, handedness, meaning whether the child is left-handed or right-handed. When is going to appear by 2 years. When it going to appear completely established, going to be at 3 years. The 36 months child can know, okay, I am a left-handed. Okay. So next one, Jagran speech, 15 at 15 months. Okay, na? So there are some important this one. See, this is your stranger anxiety where 6 to 7 months. This is the exam question. Okay, na? So you have to master some these are the important one. And this one, bidextrous approach, unidextrous approach. If you want to this one, I already made one separate video about this one. You can just try to search in my YouTube. You can just go ahead. Okay, but important I just explain. Okay, na? Next, bladder control also important. Bladder control at 4 years. Okay, na? Got it? So now this is also important. Bladder control if it is more than 5 years, meaning patient will child will develop enuresis, which is called as bedwetting. So for this one, what is the treatment? First line treatment, you have to do the bell alarm technique. If not required, then you have to go with the oral desmopressin. Got it? So and also there are some exam questions doubles. The weight will be doubles by 6 months, triples by 1 year, and quadruple by 2 years. Suppose example, a child was born, his weight is 3 kgs. Okay, tell me at 2 years what is his weight? Bolo. What is the weight of a child? His
12 kg.
Yeah, 12 kg. Great. 12 kg. Great. That's how they will ask the questions. Okay. Next one, height. 50% it increased by at 1 year. Okay. Head circumference got it. Okay. Next one, anterior frontal is closed by 12 to 18 months, and posterior frontal सी posterior P for PC पहले, ठीक है, इससे पहले, ठीक है. So first posterior and frontal is going to close within 6 to 8 weeks. Okay. Next one, these are some non-pediatric values you have to know. Next one, these are the what is the expected weight calculation. Okay. So here also important one I covered here. So vitamin A. So I think you guys know 6 months to 1 year you have to give how much? 1 lakh unit. More than 1 year to up to 6 years. And if the baby weight is less than 8 kgs, then you have to give 1 unit. 1 lakh. Okay, now 1 lakh unit. If the body weight is more than 8 kg, then only you have to give 2 lakhs. Otherwise, you have to give 1 lakh. Okay, remember this one. Less than 6 months, 50 k units. Okay, na? But next is this one. Physiological short stature. Sometimes they will ask you in the exam. So what is the familial and what is the constitutional delay? So you have to see. They will mention everything. If the parent's height is also short, then the fan height will be shorter. This is going to be your familial short stature. Okay, na? This is your familial short stature. Constitutional meaning, height may be delayed during the puberty, but when he become adolescent, everything will be normal. Okay, na? Some children's at the age 10 or 12 they may be very small, but at adolescent period they will become large. Okay, na? Height, more height. This is the questions they will ask you. So I covered here. Okay, done. Next one, can tell me this one, the answer for this one, 13th one. First read the question carefully. Okay, na? Can anyone read the question? Can anyone? If you like, or else I will read. Okay. Okay, see here. This is what, Amma? See, a patient.
This is tardive dyskinesia.
Yeah. See here. A 45-year-old woman with a diagnosis of schizophrenia. Schizophrenia has been on antipsychotic medication for a decade. What is it one? Decade. Okay, na? Not 1 to 5 days. It is decade. Okay, na? Her family had noticed that she has been experiencing involuntary movement for the past few months, including repetitive facial grimacing, lip smacking, and jerky movements of her arms and legs. What drug of choice for this condition? Can you tell me what do you call this one? It is what? Tardive dyskinesia. How you will diagnose this one? It is a facial grimacing, lip smacking, and you have to see he was an antipsychotic more than 10 decades. Okay, na? More than 10 decades. So that's why see here. So this is the this one. Yeah, this one. It is your tardive dyskinesia. Symptoms of lip smacking, chewing, and your tongue protrusion. Okay, na? If they are using from months to years. What drug of choice is your? Tetrabenazine. Can anyone tell me what is the we are using in the another cases like tetrabenazine is a drug of choice for there is one condition from neurology.
Huntington disease.
Yeah, Huntington disease. What chromosome number Huntington disease is? Chromosome number is? How many walls are there? 4 chromosome. Okay, na? What is the repeat there? CAG. So this is the case. Okay, na? Is it dominant or recessive? dominant. Okay na, see Huntington, hunter is dominant na, okay na. So he is dominant, he having the case, and case having 4 valves. This is the Huntington. Okay na. So for the acute dystonia guys, remember if they are using the medications from the like for the first 7 days, you're going to have acute dystonia. Drug of choice is going to be benztropine. Okay na, benztropine. Mark my words guys, okay na, you will get one MCQ for sure from this one. Okay na, they will give you this scenario. Drug induced Parkinsonism, drug of choice is going to be your benhexine. It is also called as trihexyphenidyl. Okay na, they won't give benhexyl, right? Okay na, this the another name is that one, trihexyphenidyl. Okay na. Next one, what drug of choice for the neuroleptic malignant syndrome? Sodium dantrolene, that's great. So if you want to remember the some antipsychotic drugs, so I will recommend you to remember this one. See olanzapine. See olanzapine is good egg. So there will be weight gain. If it causes weight gain, you have to avoid in the case of diabetic. Okay, olanzapine. Next one. This one Ziprasidine increase QTC interval. This is the exam question if you want to remember this one. And also which one is the best, which drug is the best for like who wants to become mother and who are in the menstruation age, which is the drug of choice for them, like which one is not causing any weight gain, okay, and which is safer in the like a pregnant women also, meaning it will not disturb the menses. It is your aripiprazole. Okay na, this is the exam question. All exam question only. And which antipsychotic is having most anti-suicidal property? It is your clozapine. Okay na, clozapine. So what is the side effect here? Tell me. Clozapine, serious side effect is a seizure. Serious is a seizure, and it is your agranulocytosis. These are the questions they will ask you in the exam. Mark my words, one MCQ for sure. It's your wish. Next one from the TB okay, you have to know about this one. Which of the following is false about the bedaquiline? Tell me. Bedaquiline false about that one. So bedaquiline, tell me. Side effect includes peripheral neuropathy. No. Side effect is your, tell me, it is your isoniazid. Okay, got it? So this is the wrong answer. So see, tell me bedaquiline, you have to learn. So bedaquiline, bedaquiline means QT. He is bedaquiline. See bed QT. Okay na, bed QT. So tell me what happens. It will. So he is a QT. So it causes QT interval. Okay na, Qulin QT causes significant QT in prolongation. What is the MO of bedaquiline? It causes inhibit the ATP synthesis of the bacteria. Okay na, these are the questions they will ask you from the bedaquiline. And other anti-TB drugs actually there is new anti-TB drugs, but in India, in Harrison they change everything, but in India still we are following the old rules only. Okay na, so if they particularly mention you like from the new guideline, then you have to go with this one, or else mark the old one. Okay, so from the TB drugs I will tell you one only important things you have to remember. See, isoniazid, they will ask you which the side effect is it is your peripheral neuropathy. Okay na? So that's why you have to combine with the B6 pyridoxine. This is the one question. Next one, rifampicin. Rifampicin inhibit the RNA polymerase. Main thing is side effect is causes the red discoloration of the urine. Okay, na? From this one question. You have to remember. Okay, next one is the among all the TB drugs, which one is the most hepatotoxicity? Among all this one, which one is the most hepatotoxicity? Tell me. It is your pyrazinamide. See, okay na? Pyrazinamide. It is a para. Okay na? It is your para. So para. See para. Okay na? Pyrazinamide. Okay na? Pyrazinamide. Okay na? Got it? Arey, who is this ra? Coming, going. Okay. Got it, So next one ra, ethambutol. Ethambutol causes your side effect is your eye toxicity, red green blindness. Okay, this is the questions you have to know. Tell me, ethambutol causes red green blindness, sildenafil causes blue green color. Okay, now tell me here, sildenafil uses for the what? For the erectile dysfunction. Got it? So erectile dysfunction, blue films. That's why it is a blue green color. Okay na? Got next, digoxin, yellow vision. Okay na? First three you have to master. In the leprosy in the last exam, 1 year back exam, they gave what is the drug up, what is the dose of rifampicin, rifampicin in the passive bacillary. Dose is the 600 milligrams. Okay, 600 milligrams. Got it? So that's why you have to master the dose also. Okay. Done. Okay. Next question. Tell me this one answer. जल्दी बोलो, आंसर बोलो. आंसर बोलो. Heart failure and started on the drug.
Empagliflozin.
Yeah. See, ampa dampa. Okay na? See, ampa dampa. This is the answers. See, answer should be ampa or dampa. Okay na? See, whenever you see the question heart dampa, why it causes the natriuresis. So remember, empagliflozin is a what drug? It is your SGLT2 inhibitors. Can anyone tell me where does SGLT1 located? Where? Kidney, intestine, brain, heart. Where is the SGLT1? SGLT1 at where? Intestine. Okay. SGLT2 at kidney. Okay na? So tell me here. So actually what happens here? SGLT2 inhibitors. So actually what is the function of your SGLT2? So SGLT2 what happens? It will takes actually SGLT2. Its function is that from the nephrons, guys, from the nephrons, whatever glucose is coming, SGLT2 it will reabsorb the glucose. That's what happens in the urine at the when you pee, there is no glucose. So if you are going to block this one, what happens? All the glucose will goes into urine. Okay na? From the all the blood, all the glucose will be going to urine na. It will be excreted out. Got it? So that's what happens ra. All the glucose in the patient who are diabetic, so from the blood all the glucose is going to be excreted out. Okay na? So apart from this one ra, there will be loss of sodium also. So this is natriuresis. So who is having BP, okay na, having the hypertensive also, it will also act as a antihypertensive also. Okay na? And also it is very very safe in the patient with the, see, if anyone ask you which is the safe medication for the diabetics, see, hypertension, okay na, hypertension with the congestive heart failure, diabetes patient, and also with a diabetic nephropathy, what is the drug of choice? Must mark the DPP for your SGLT2 inhibitors. Got it? So tell me, if there is more loss of glucose from the urine, then what happens? Tell me. Obviously, if there is more sugar, there will be infection. Okay na, infection. So what is the side effects? UTI, genital mycotic infections are very common. Got it? So don't never forget this one. So other drugs are having, so do you know why I kept this one? Okay, see, remember one thing, this is you, okay, this is you, it's you, okay, and meaning, okay, and you are ordering food, and his name is incretin, okay, his name is incretin, and here is chef, he is cooking everything, he is a pancreas, okay, he is a pancreas. So tell me if you want more food, then waiter will tell to kitchen to cook more. Got it? So like this same era, if you are going to eat more food, then incretin will tell to pancreas that, okay, this guy is eating more food today, so you have to release more insulin. Got it? So this is what incretins will do. Incretins, they are doing. So, but you know what happens? Incretins, after doing work, they will die. Got it? They will die immediately. So what drug I am talking about? I am talking about your GLP analogs. Example, your drugs are semaglutide, liraglutides. Okay na? Semaglutides is also called as your Ozempics. Nowadays we are using for the weight loss at giving subcutaneous injections. Okay. So incretins. So what? So for examples, if the incretins are dying, then what happens? Then to give the life, there is a savior, Superman, which is your DPP4 inhibitors. This will save this one. This will save the incretins. So there will be more incretins. This is your DPP4 inhibitors. Got it? Clarity, yeah? Okay. So DPP4 inhibitors, it will give life to the incretins. So what are DPP4 inhibitor examples? See, I will tell you one thing. See, all the drugs of this class of drugs are like a girl name. See, Sitagliptin, Vilda, see, O Sita, O Vilda, O Lina, O Sakshi, O Lina, O Vilda, O Sakshi, O Sita. See, very easy. So all these girls they like to change the DP. So they are DP4 inhibitors. Oh my goodness. See, very simple. All the Sitagliptin, Vilda, Lina, Sakshi, oh Sakshi, DP4 inhibitors. They are DP4 inhibitors. They are DP lovers. Okay na? So out of all them, which is the safe in the CKD patient, you have to किसको लेना है? लीना को लेना. Okay na? And one thing you have to remember, this Saksha is very dangerous. She is very dangerous. She is maintaining 50 to 60 boyfriends. She is very toxic. She is very toxic to boys' heart. Okay, she is very toxic to boy's heart. So it is contraindicated in the case of the your congestive heart failure. Got it? Okay na? No more doubts. Next one the bigonites. Bigonites example metformin. Metformin what will do ra? Metformin will do what will do from the liver. It will inhibit the what? It will inhibit the hepatic glucose. It will inhibit the hepatic gluconeogenesis. Can anyone tell me what are the only two drugs? What are the only two diabetic drugs which cause the hypoglycemia? Which one having the risk of hypoglycemia? It is your one is your meglitinides.
Sulfonides.
Yeah, this one. And also your meglitinides. Sulfonylurea is having very high chance of having side of hypoglycemia. That's why they will ask you this question. Hypoglycemia, more the sulfonylureas. Okay na? So metformin inhibit the hepatic gluconeogenesis. So metformin it also causes the weight loss. Oh, okay na? Also causes the weight loss. And remember, it will side effect is your causes lactic acidosis and also vitamin B12 deficiency. So that's why whenever you are giving the metformin is very common. So you have to give injections of methylcobalamin, or you can give the methylcobalamin. You have to give the supplements. Got it? Done. Next one, your sulfonylureas. What is the MOW? It closes the ATP sensitive potassium channels on the beta cells of the pancreas. As I said that side effect is your hypoglycemia. Example gliclazide, glipizide, glimperamide. So nowadays currently gliclazide is very famous. Glimperamide it's not very safe, but apart from this one gliclazide is very good. Next one is one pioglitazones. Okay na? See, for the insulin resistance there is two drugs to use. First one is your metformin and your pioglitazones. These two drugs are for the your insulin resistance. What is the side effects of this one pioglitazone? Tell me. It causes okay, risk of bladder cancer, and also it causes osteoporosis. What is also it causes osteoporosis. There is risk of bone fracture. Okay na? But the risk of MI only by rosiglitazone. And it also causes the retention of sodium and water. Hence what it is a contraindicated in the case of your congestive heart failure and hypertension. Got it? Done. Next one is alpha glucoside inhibitor. See, alpha glucoside inhibitors, what happened? They will see all our other drugs are acting on the pancreas and are acting on the liver, but these guys, this guy, they are not acting on anywhere, but they are doing the just inhibiting the intestinal absorption of the carbohydrates. Meaning whatever food you are eating, glucose is not going to break down. They are not going to absorb. They will directly go to the stool. Got it? So that's why there will be a malabsorption. Got it? Example acarbose, oglibose. Okay, these are the questions. Any doubts? So I think no more doubts. So this is very important slide draw. Okay, just to answer this one. So if the patient is having diabetic plus heart failure, what drugs you have to avoid? Pioglitazone. What drugs you have to give? Your dampa-empa. Okay. So these are the how to read one. Remember, maximum HbA1c reduction by metformin. Longest insulin, Diuretic. Okay, done. Next one, tell me this. The answer. Tell me what is the answer? We are about to finish. Tell me. I think this is very depth. I am explaining. Answer bolo. जल्दी जल्दी बोलो. What is the answer? They said that, see, I know everyone we will mark the psilocybin, I think so. See here, see what they asked. I know it is going to be BPH, but what they asked here, BPH does not produce hypotension. See, we are having the alpha 1 receptors. See, we are in the alpha 1 selective alpha 1 blockers. It is going to block the both. It is going to block both alpha 1A and alpha 1B receptors. See, remember alpha 1 blockers, they are going to block the both alpha 1A and alpha 1B. So it's going to block the alpha 1B also, going to block the 1B also. Then tell me what happens. B for what? My blood, meaning it after the blood it will do the blood constriction, so it will leads to what your fall in the blood pressure. That's why if you are going to give the prazosin or terazosin or doxazosin, whenever you are going to prescribe in a normal individual, then what happens, there will go, then it leads to postural hypotension. That's why you have to avoid this one. So BPH plus hypertension, drug of choice is going to be what? Prazosin or terazosin. Got it? So in two types of alpha 1 blockers we are having, I said that. Got it? So got it? So if you're going to give the selective alpha 1 blocker, it will block both 1A and 1B, so that's why it causes the hypotension. Suppose example, if you are going to, that's why you have to give the selective alpha 1A blocker. If you are going to give the alpha 1A blocker, it will block only alpha 1A. That's why what happens, Amma, then it will not causes the postural hypotension. It will that's why alpha 1A, it will relax the muscles at the urethra. Okay na? Got it? That's why it was. So that's why you have to give only alpha 1A blocker. Example, your tamsulosin. Psilocybin. Got it? So the answer should be here psilocybin. Hope it is clear. So, and also remember 5 alpha reductase inhibitors, example finasteride, dutasteride. Okay na? So you have to give the tamsulosin plus finasteride or dutasteride. You have to give the combination. So if you're going, so tamsulosin is going to work within 1 hour. It's going to be work very faster. It will causes the relaxation of the smooth muscles of your bladder. Okay na? So it is of your prostate, so it is going to give some relief immediately. But for the finasteride or dutasteride, it will take more time to reduce the size of the prostate. Got it? Good. So okay, so this one you have to read by self. You always this question they will ask you for treatment of overactive bladder. Okay na? And also urinary stress incontinence. These questions are very important for the neurogenic DI and nephrogenic DI. What is the drug of choice are very important. Okay, I will ask you one question. What is the drug of choice for the hypertension? Tell me. Tell me, what is the drug of choice for hypertension? Hello? What is the drug of choice for hypertension? Hello? Tell me, Satana. How? see here, remember here, if anyone asks you, it written already clearly. What is the if anyone ask you what is the drug of choice for hypertension? It is going to your thiazides. In clinical cases, we are using the ABCD rule. ABCD rule. Like first you have to start with ACE inhibitor, beta blocker, calcium blocker, then diuretics. But if anyone asks you what is the drug of choice for the hypertension, it's going to be your thiazides. Okay, now thiazides. Tell me here, 50-year-old woman prescribe a diuretic by doctor to manage hypertension. If you don't see this one, then also you will mark the answer as the B, option B, hydrochlorothiazides. This is your DCT now. This is your CD. Okay. This is your thick ascending lip of Hamlet. We will study this one in the next slide. Okay. So actually, if I want to say something, I can explain you within 1 minute. This one. Okay. You have to read this table. Got it? So loop diuretics, thiazides, potassium spent diuretics, and your osmotic diuretics. What is the mechanism of action? Where they are going to act? You have to remember everything. No? So this table may looks very scary for you. I think this table may looks very scary for you, but don't worry. I am going to make you very simple. Okay, na? Very simple. Okay, see here. This is your, I think you know the parts. PCT. This is your loop of Henle. This is your thick ascending loop of Henle, and this is your distal DCT, and this is your CD, collecting duct. They are going to mark anywhere. They are going to mark anywhere at the nephron. Okay, now so this, for example, they will mark here. They will tell you what diet is going to act at the PCT. So it is your answer will be, what is your carbonic anhydrous. Okay, now carbonic anhydrous. What is the okay, now so example is your acetozolamide. Example your they will ask you
Mountains.
Yeah, mountain sickness. So why you know why we are going to use the acetozolamide in case of mountain sickness? Tell me why? Because they causes the loss of your bicarbonates. So there is more alkalosis. So there will be respiratory center will be down. So that's why you have to make it acidosis. That's why you are going to inhibit this one. It will become acidosis. Then your respiratory center will be activated. So that's why you have to treat with the acetozolamide. So acetozolamide, it is your, they will ask you what is the MAU. It is going to be a carbonic anhydrous inhibitors. Examples is going to be your acetozolamide. And remember here, what are the drugs for using the glaucoma for the drops. Okay, so next one also you see your mannitol. Mannitol actually it will work on PCT and also it will work on the loop of Henle. Okay, loop of Henle, but it will more act on the loop of Henle. If anyone asks you which is the best one, then you have to mark the loop of Henle. Descending loop of Henle, mannitol is going to act more. So mannitol, they will ask you what is the uses. Tell me. It is going to the use of cerebral edema. Cerebral edema, when it is contraindicated mannitol, if there is any bleed, this is cerebral hemorrhage, if there is any active bleeding, you have to stop the mannitol. Mannitol is for to decrease the ICP. Got it? Next one, loop diuretics. See, loop diuretics are very important. So loop diuretics, it going to block your sodium, potassium, and 2-chlorine symporter. Got it? So which is the most longest one? It is going to your torsemide. So they will ask you First one is the you have to know about this one. What is the mouth of a diuretics and what is the side effects? See, loop lose everything. Loop will lose everything. So it causes hyponatremia, hypokalemia, hypomagnesemia. Got it? Everything. Got it? This is the question. So where we are going to use the loop diuretics in the case of pulmonary edema, hypertension emergency. Okay, na? In the acute heart failure, you are going to use in the case of you are going to use this one. Next one coming to your thiazides. Thiazides, first of all, first question, it inhibits the sodium and chlorine symporter. Okay, got it? So in what cases we are going to use the thiazides? So thiazides, we are going to use thiazides is the first line choice for the hypertension. It is also used in the treatment of your hypercalcemia. Next, tell me, thiazides example.
Nephrogenic diabetes insipidus.
Yeah, and also example thiazides like example metallazone. It is used in the case of your CKD. So that's what you have to know, okay na? It's going to be very taking more time. So if you want to watch the full lecture, please once watch in my YouTube, okay? But see now, and also you have to know the potassium sparing diuretics. See, all the diuretics will lose the potassium, but potassium sparing diuretics will not going to lose the potassium. It will cause the hyperkalemia. This is very important. So what are the drugs are aldosterone receptor antagonists is going to be your spironolactone and the epiluron. Which are ENaC inhibitors, which are ENaC channel blocker is going to be amyloid and triamterone. Triamterone and amyloid, they are used in treatment of lithium induced DI and Liddle syndrome. Got it? And remember the potassium sparing diuretics, they are used in the treatment of your Cohen syndrome, resistant hypertension. Got it? So you have to know this one. So we have to be very fast. It's between one. Okay, tell the answer here. Answer bolo. See here, they said.
IgE.
See here, this is O'Malley. See here, remember omalizumab. So IgE. Got it? Done. See, very simple. So which is very important for you guys, I will tell. Okay, so this table is very important. Tell me, which is the mast cell stabilizer is going to be your sodium chromoglycate. Which is the 5-lipoxygenase inhibitor, 5-LOX, it's your gelatin. And which is the leukotriene receptor antagonist is going to be montelukast, gefileucast. Got it now? So which drugs will causes the side effect of the Churg-Strauss syndrome, meaning there is a more number of eosinophils. So it is going to be Churg-Strauss syndrome. For Churg-Strauss syndrome, is drug of choice is going to be your omalizumab. Okay na? So this table is very important, and these are very important. These are very important. See, omalizumab, I said, blocks the IgE. Next one is the mepolizumab. How to remember? Mepolizumab. See, me polling. See, me polling every 5 years. So mepolizumab. Here IL-5. Benralizumab, it is a interleukin 5 receptor blockers. Got it? Next one, the theophylline. You have to remember, it is a PDE4 inhibitor. Side effect includes seizures, arrhythmia, headaches. This is the important one. And now coming to here, you have to remember the side effects are very important for the beta 2 agonist. Got it? These are the important one. If you want to know in depth, you have to watch this also in my YouTube channel. Okay, next one. Tell the answer here. Answer bolo. Ray, tell the answer, Ray. See here.
Unpaired treaters.
Unpaid. See, let's see. See, we are having parametric and non-parametric test here. So it will comes under parametric, comes under quantitative variables. Quantitative. What is quantitative? Tell me. Variable
Which can be measurable.
measures, which it can be measurable. Examples: weight, height, hemoglobin, age, BMI, BP. Hypertension measurable, hypertension is a disease, how can we measure this one? BP can we measure? BP, obesity, example obesity, gender, religion comes under qualitative. For the quantitative, tell me here, for the quantitative, we are having the total 3 tests here: paid, unpaid, ANOVA. Qualitative, we are having the chi-square test. Okay, na? For the paid test, single group T test, single group T test, unpaid T test is going to 2 groups. ANOVA. Next here, okay na? Disturb us. Okay, the next one here, qualitative. Tell me. Yeah, so qualitative I have chi-square test. Okay na? So what they asked here, mean blood pressure. Okay na? Mean blood pressure. So tell me, BP can be measurable or not? Measurable or not? Measurable. So you have to rule out the chi-square. Okay na? So you have to take either paid or unpaid or ANOVA. Okay na? So they asked you mean blood pressure, 2 groups. So it's going to be your unpaid test. Okay, done. Can you tell me this one?
Paid T test.
Paid T test. Hemoglobin, they asked that. What they asked? Hemoglobin. So hemoglobin is a quantitative, before and after. Paid T test. Done. Simple. Just you have to know this one. Quantitative or qualitative, it will be easy for you. Next one. Tell me this one. Secondary. See here, if there is a primordial, means there is no risk present. Example, health education. You have to health education, like health tips you have to give to your childrens. Okay na? To do not smoke. Got it? See, no risk present, it is a primordial. If there is a risk factor present but not started, meaning you have to do the health promotion and a specific promotions. Okay, example, suppose example, you have to wear the mosquito nets. Why mosquito nets? It is your specific protection. So it is your primary level. Got it? So health promotion, like you have to health, in the health, like you have to wear the mask in the COVID times. These are the primary levels. Got it? Secondary levels, what am risk factor present, no complications, meaning disease is there but there is no complications. Okay, there is no complications. Okay na? So for this one we have to going to do the, what is the mode of intervention, how you are going to prevent this one. You have to do what? That's why you have to do the early diagnosis and treatment. Got it? So you have to do the early treatment and early diagnosis. That is your secondary. If you see any screening test, treatment, you have to mark the answer as secondary. What is next one? Tertiary test. Tell me. Tertiary meaning disease has already progressed to disability stage and complications. So you have to What is the mode of intervention? You have to avoid them from the disability, and you have to do the rehabs. You have to make them to go to for the rehabs. Got it? This is all about the levels of prevention. You have to know. Next, tell me this one, what is the answer? This is going to be Ops policy C5C6. Okay, na? Got it? So this is your Ops policy, Klumpke's policy, winging of scapula here. Winging of scapula here. Tell me here. It is injury to long bones. Injury to what nerve? They will ask you. Is your long thoracic nerve. Okay, na? What muscle paralyzed here? Sertus anterior muscle paralyzed. And what border of the scapula? Medial border. Is your medial border. Got it? Medial border. Okay. In the Klumpke's, in the Ops policy, you have to learn this one. Okay. This is also very important for thoracic outlet syndrome. Which vessel is going to compress? This is going to subclavian. Got it? Very important slide. Okay. This is the last one. Can anyone tell the diagnosis of this one? Okay. For this one, I have one thing here to tell. Okay. See. Do you know what is SALI? SALI means, so for example, my brother's sister will be SALI for me. Okay. See here, SALI. S for your, tell me, septum. A for anterior. L for lateral. I for inferior. Got it? So just write like this. Okay, na? V1, V2, V3, V4. Done. Next one, V5, V6. Got it? We are done with the chest leads. Now see here, from here start this one. Yeah, from this one. Yeah, 1, first, second, third. Okay, and here AV augmented leads here, AV, yeah, AVF, no, yes, AVF, AVL, yeah, L only na, so AVL and this is AVF. Got it? So you have to see the leads on the ECG. If it is V1, V2, it is going to septum. V3, V4 is going to anterior wall. V6, V5 and AVL and the first lead is going to be your, tell me, it is going to your lateral side. It is 2, 3 and AVF is going to be your inferior wall MI. Okay, na? If it is going to be your inferior wall MI, what is the artery is going to block there? Tell me. At the inferior wall MI, tell me what is the artery going to block here? Right coronary artery. Anterior and septum is going to be your LAD. Is going to block. Got it? For lateral wall MI is going to your left circumflex artery. This is how you have to remember. Okay, na? Got it? So this is how I learned this one. Okay, na? So anyone tell me this one? Diagnosis of this one. See, what type of MI is it? This is first limb, second limb, third limb, అంటే we are having the augmented leads AVR, AVL, AVF. Got it? Chest leads we are having V1, V2, V3, V4. Tell me. Sali. Okay, tell me at what leads you have to see. Septum you have to see V1, V2, anterior V3, V4, lateral V5, V6. You have to start the limb leads 1 and augmented leads your AVL. Sali inferior, so we have limb leads 2, 3 and your augmented leaf is going to AVF. Tell me where is the ECG changes. Check the first one. There is ST elevation. No. Check the second one. Here ST elevation, second limb, and third one, see this is the ST elevation, AVF also ST elevation. Got it? So it's going to be worse. Inferior wall MI. Going to be your inferior wall. Something happened. Inferior wall MI. What artery is going to block here? Tell me. Inferior wall MI. Right coronary artery. Got it? That's it for today. Hope you guys learned something. Okay. Hello. Thank you very much.